Dear friends, welcome to Dental Education Hub YouTube channel. Today we are going to discuss a very important topic, that is hypodontia or congenitally missing teeth. So what we are going to discuss in this video lecture, we are going to discuss what is hypodontia, what is oligodontia, the clinical features of hypodontia, and the developmental disorders and syndromes that are associated with this condition. And at the end, we will discuss briefly about the management of hypodontia. So watch this lecture till the end and don't forget to give us your feedback in the comments. Hypodontia is defined as the failure of development of few tooth germs that results in the missing teeth from the dental arches. So the tooth germ, it fails to develop, and as a result of that failure, there will be missing teeth in the dental arches. Another term that is similar to hypodontia, another term that is used frequently when we discuss hypodontia is the oligodontia. So oligodontia, it is a subcategory of hypodontia in which 6 or more teeth they are congenitally missing. So for example, this is the picture of the maxillary arch. So this is the picture of the maxillary dental arch. So in this picture, these are the maxillary central incisors, and this is the canine, and this is the canine. So the lateral incisors, they are missing. This is the retained deciduous canine, and this is the maxillary first premolar. This is the retained deciduous maxillary second molar. So the maxillary second premolar, it is missing. In addition to that, this is the permanent first molar, second molar, and in this patient, the third molar, it is also missing. On the left side, this is the central incisor. So the permanent lateral incisor, it is missing. This is the permanent canine. This is the maxillary first premolar. The second premolar is missing, and instead of that premolar, there is retained deciduous second molar. This is the first permanent molar, second molar. So lateral incisors, second premolars, and the third molars, they are missing. In the mandibular dental arch, this is the central incisor, lateral incisors, canine, first premolar. So the second premolar, it is missing, and there is retained mandibular deciduous second molar. Similarly, on the left side, this is the central, lateral, canine, and the first and the second premolars, they are missing, and the third molars, they are also missing in this patient. So there are 6 or more teeth, they are congenitally missing in this case, and it is referred as, this type of hypodontia is known as the oligodontia. So what are the clinical features of hypodontia? So the clinical features of hypodontia. So in the hypodontia, it is most common in the permanent dentation. So you will see the cases of hypodontia mostly in the permanent dentation, and in the primary dentation it is rare. And mostly in the primary dentation, if it is present in the primary dentation, usually the mandibular incisors, they are affected. As I have already showed you in the last picture, there will be retention of the deciduous teeth because the permanent successors, they are absent, and it is often symmetrical, like the permanent teeth, they are missing on both sides. For example, if the second premolar is missing on the right side, in most of the cases it is missing on the left side as well. Most often missing teeth, the most commonly missing teeth are the maxillary and the mandibular third molars. So they are commonly missing. The second most common missing teeth are the mandibular second premolars, though the maxillary second premolars, they are also missing in some cases. The maxillary in the anterior region, the most commonly missing tooth is the teeth are the maxillary lateral incisors. So here, there's an interesting case of hypodontia. In fact, it is an oligodontia because six or more teeth they are missing. So this is the permanent maxillary central incisor. So there's a gap, and this gap is for the maxillary lateral incisors. So the maxillary lateral incisors they are missing, and instead next tooth is a canine. So this is the pointed tooth, and this is a pointed tooth. So the lateral permanent maxillary lateral incisors they are missing. So this is a canine, this is the first premolar. So this is the canine and this is the first premolar. So this is the deciduous second molar, and there is no second premolar on the right side, and similarly there is no second premolar on the left side, and there's retained maxillary deciduous second molar. This is the first molar and this is the second molar. Similarly, this is the permanent first molar and the second molar, and the third molars they are also missing. So in the maxillary arch again, the lateral incisors they are missing, the second premolars they are missing, and instead of that there are retained deciduous second molars, and the third molars they are also missing. Now, in the mandibular dental arch, central incisor it is present, lateral, this pointed tooth is the canine, first premolar is present, this is the second deciduous molar, and the second mandibular premolar it is missing, and this tooth is a retained tooth. This is the permanent mandibular first molar, this is the second molar, and the third molar is missing. Now, on the left side, central incisor, lateral incisor, canine. This is the first premolar. This is the deciduous second molar, which is retained. You can see the morphology of the root and the crown. So, the mandibular second premolar, it is missing from the dental arch. First permanent molar, second permanent molar, and the third molar it is also missing. So this is a classical case of hypodontia. It's more specifically oligodontia because six or more teeth they are missing from the dental arch. Now, there are developmental disorders and syndromes that are associated with hypodontia. Sometimes, in absence of any developmental disorder or syndrome, even then hypodontia is present. Most commonly, the syndromes or disorders that are associated with hypodontia are hypohidrotic ectodermal dysplasia, cleft lip and palate. So the most commonly the tooth are missing in the anterior region. Krausen syndrome, Down syndrome, orofacial digital syndrome, and Alice Van Creveld syndrome. So in these syndromes, the tooth, the most of the patients, they have hypodontia. So the management of hypodontia. So removable prosthesis, for example, dentures. Fixed prosthesis, for example, bridges. Dental implants, they are also a fixed prosthesis. Sometimes the orthodontic treatment is performed to close the spaces because of the hypodontia. So this is all about hypodontia. If you have any questions, feel free to ask in the comments below and I'll respond to your queries. Again, thank you so much. Follow us on Instagram at Dental EduHub for question images and flashcards. Thank you so much and stay blessed.